COVID's been hard. It's been hard to be the only ones in the room sometimes with these patients who are so sick.
They're on the front lines, risking their health to protect yours. They work with some of the sickest COVID-19 patients in the state. Tonight we go inside the world of a special kind of nurse at IU Health.
They are the healthcare workers who made it possible for those with severe COVID illnesses to have a place to go and get better. WRTV's Megan Sanctorum explored everything that a resource nurse does for us and what keeps them going even during the toughest days of the pandemic.
For nurses like Quentin Fair, no 2 days at work are the same.
I float to like 3 different hospitals, Methodist, University, and IU West, and go to about 20 different units.
That's because he's one of IU Health's 450 resource nurses, a skilled group trained and ready to help fill gaps, jumping in wherever needed.
Resource has always been noted to be that put me in, coach. You know, what do I need? What do you need from me?
Some call them the Navy SEALs of nursing, and leaders with IU Health say they've been especially important during the pandemic. They helped make the 40-bed COVID-19 ICU at Methodist possible.
So with that being a new unit, there wasn't a team that was already hired to that unit. And so resource nurses were tapped on to support the staffing of that unit.
Fair was one of them.
Opening up a unit from scratch, it used to be a NICU, and we transformed it into a fully functioning adult ICU within hours to days. And that was really cool to see the change.
He says it hasn't always been easy.
Kind of an all hands on deck approach at times. These patients got really sick, and it was really overwhelming.
But this team was determined to be there for it all.
Being the only one in there when, their final moments were coming. And it was nice to get families on FaceTime, and we were able to do that. And that really, I guess, helped in those moments. But there was a lot of times when it was just us in the room for hours with the patient.
Fair says that has been the toughest part, but what keeps him going?
There was a lot of people that did get better, and we, those miracle stories. You want to come back because you want to see these people improve.
And that's their goal every day, no matter what unit they're called to help out in. Working for you, Megan Sanctorum, WRTV.
Leaders with IU Health say navigating this pandemic has been a team effort, and all of their employees stepped up to make sure patients got the care they needed. At one point, nurses from Riley Hospital for Children even went over to help work the COVID-19 ICU at Methodist Hospital.
It was crazy to see, these Riley nurses who take care of babies and kids jump in with adults and just take it and run with it. They were amazing, and they excelled in their role and really made it that everybody was, pieces of the puzzle that glued it all together, because we wouldn't have been able to do it without everybody's help.